Hi guys, welcome back to my channel. So this video is going to be how to deal with nursing preceptors, and this could be for a new nurse, or like say somebody like me. I've been a nurse for a while, but it was in long-term care, and so now I'm coming in, I'm new to the hospital, and just how I dealt with nursing preceptors as, just as a new person, regardless of how long you've been a nurse. Even if you switch hospitals, each hospital is different, different policies, different units, require different things. So just some tips on how to handle or deal with nursing preceptors. So my main thing is to be respectful. It doesn't matter, in my opinion, how long I have been a nurse, especially if I'm new on a unit or I'm doing something new. I look at it like, who cares if I've been a nurse for 7 years? She's been on this unit for 2 years. So she has 2 years worth of knowledge that I don't have, on this unit. And I look at every nurse and every opportunity, every person, even if it's a CNA, anybody who works on anywhere. I'm always looking for learning opportunities. I know and I understand that I don't know everything, and that learning opportunities can come from anywhere. So I always keep an open mind of, this person has something that they can teach me and I can benefit from them. So I always keep that type of mindset when I am dealing with a new preceptor. So again, just being respectful, also being open to instruction and correction. And sometimes that can be hard, especially if you're doing something right and they just want you to do it more like their way. It's kind of a gray area. Just make sure that that your integrity isn't being compromised. Um, I had one nurse tell me that I shouldn't like check, like the patient's alertness, because it's not really necessary, and that went against my morals and just against my nursing practice. I will absolutely check the orientation of my patient, their mental status. That's not a waste of time to me ever, but in her opinion she felt like it was, and that it did need to be documented on, and I disagreed, and I did what I wanted to do. But I was open. I asked her why she felt that way, and she told me, and I didn't agree, so I didn't do it. So, use your own judgment there, but be open to instruction and correction. Um, Also, jump in there when, try to do things, yourself. If you've never seen something done or you've never done anything, definitely watch it the first time, sometimes like the first couple of times, but definitely don't be afraid to jump in there. This is your opportunity to, you have your preceptor there to correct you and to watch you and to fix anything that you're doing wrong. So you definitely want to do it while you have the backup and support there, before you get out on your own and you have that order to do it and you've never done it. Like if you've never done, put an NG tube in, do it with your preceptor, so that, once you, if you're doing it wrong, she can tell you like, nope, that's not right, let's try it like this, before you get on your own and you're in there by yourself trying to do it, and it's not working out. So yeah, that's the thing. Just don't observe too much. Don't get too scared to try something. Take advantage of having someone there to correct your mistakes. Also, look and ask for new opportunities. If most jobs will give you a list of things they want you to have checked off, so definitely look at your list and look at it and say, oh, okay, I haven't administered blood yet, I haven't inserted a Foley yet, or things like that. Find those opportunities and then tell your preceptor, like, this is the opportunities that I'm looking for, so that they could talk with their charge nurse and try to get you more patients that would have that. Or you can ask other nurses on the unit, like, hey, if your patient needs blood, or if your patient needs a Foley or an NG tube, or an IV started, could you let me know so that I could try it? Definitely try to do that, because again, your time with your preceptor is limited, so you want to get as much experience in as you can with your preceptor while you can. Ask a lot of questions. Don't be afraid to ask questions. You're not going to be looked at as stupid. No matter what the question is, ask it. I always look at it like, I don't care what the question is. I don't care if you think I'm dumb or not. I don't care. It's something that I don't know or I'm not sure about. And once I ask the question, boom, now I know the answer. Now I know. Now there's no more doubt in my head. Now I know. So I definitely ask questions. If I have doubt or if I'm unsure about something, I will 100% ask questions. Ask questions. That's what your preceptor is there for. Ask those questions. Um, Along with that, ask for help when you need it. Sometimes, especially with me, some preceptors that I have had have kind of backed off more when they find out, oh, you've been a nurse for this long. Oh, okay. So sometimes they would just assume that I know things and they'll give me a little bit more freedom before I'm ready in certain areas. And so I definitely will ask for help when I need it. And I would tell them, like, no, yes, I've been a nurse for 7 years, but I haven't been doing this type of nursing. Like, I still need help. Like, look at me as a new grad, as far as like on this type of unit. So yeah, definitely ask for help when needed. Always put your patient safety first, and protect your license and protect yourself. If it's something that you're not sure about, ask for help. Um, yeah, definitely don't let pride or anything or just being afraid of looking dumb get in the way. Um, Also, if you don't have the best preceptor, if your preceptor is kind of lazy, fortunately, you may come across that. Some preceptors only want to do it for the money, for that little bump in their pay each hour, and they may not really be wanting to teach and help out. Don't let them get away with that. Um, ask them again, ask them for help, and then let your manager know, like, I need a new preceptor. This isn't working. It's not working, and my clock is ticking for when I'm out on my own, and I need as much experience and knowledge as I can get during this time, and I don't believe this preceptor is going to be able to give me that. So definitely don't um, don't let your preceptor be lazy, and if they just refuse to help, get a new one. Definitely do that. So yeah, those are some of my tips and ideas on how to deal with preceptors as a new nurse on a unit. So yeah, let me know if you have anything to add to that. I didn't really have a lot of things, but yeah, add some things down there. And yeah, thank you for watching. Bye.